my name is Cassidy Van Bibber. I am 20 years old and I major in nursing at Miami University in Hamilton, Ohio. So the photo that I put in for the assignment is a photo of me when when I was in the emergency room a few months ago due to a complication that I had with norovirus, which I was eventually able to recover from. But I decided to use this photo as I have a chronic disease that has kind of caused me to be in and out of hospitals a lot. So I thought that this photo helped to envision that, as it helps to, I think that it represents the ongoing journey I am and have experienced as a patient in the healthcare system. So the disease that I have is Crohn's disease, which is in my large intestine. And I was originally diagnosed with it when I was 17, and I officially went into remission a little over a year ago now. But even still, I go to an infusion clinic every 2 months, which makes sure that I stay in remission and that I don't develop any further complications. With these visits, I think that they have given me the firsthand experience of what patients expect from their nurses. So I thought that this photo also helped to explain my why, because I'm very familiar with the hospital environment and how the nurses and doctors treat the patients that they see. So before I went into remission, I had been in the emergency room quite a few times, just simply due to the extreme pain in my abdomen that was caused by the Crohn's disease I had, which was kind of, I remember seeing somebody say that it was kind of just like, the best way to describe it, it's just 10 out of 10 pain, and it's super sharp. It's not fun. But during that time, I had some really amazing nurses, and I also had some, not so good nurses that made me feel almost unwelcome when I was at the hospital. So with seeing the differences in the nurses and seeing how their different attitudes had affected me personally, I think this really helped me to solidify my goal as a nurse, to be the kind of nurse that makes their patients comfortable and makes them feel at ease when they're staying at the hospital. So looking to the future, I am currently leaning towards becoming an intensive care unit or emergency room nurse. I decided on this path as that's where patients tend to feel more scared, and I know that's where I felt more scared, and when that's also where they might need to be more comforted. And I think that that's just kind of the realm I personally feel more comfortable with, helping patients with in that regard, as I feel like I just really want to make sure that patients are comfortable and are happy with their stay. So, with the source that I found, it showed that nurses with more experience and better education had better attitudes and quality of care when it came to helping their patients, especially at the end of life of the patient. I think that this knowledge really motivates me to become the best nurse I can be and to get the best education possible, so I'm able to make a difference in the patient's stay. Ultimately, my personal experiences with my disease and, my hospital stays and everything, and the research I've found, I think strengthen my commitment to providing compassionate and high quality care that addresses the medical and the emotional needs of every patient that I encounter. And I really truly hope that I can be the kind of nurse that makes someone's stay, no matter the length, somewhat enjoyable and comfortable by providing the best care I can possibly do, because I know that that's what I would have wanted. All right.